Next, we have Dr. Aparna P, who will be presenting on validity and reliability of flashlight test and von Herrick's test in detecting occludable angles.
Good morning. My presentation is on the flashlight test and Van Herrick test are poor predictors for occludable angles. The aim of the study is to determine the validity and reliability of the flashlight test and Van Herrick test in detecting occludable anterior chamber angle. 139 eyes of 70 patients were studied in this study, and the patients were first seen by a second year postgraduate resident in ophthalmology, followed by evaluation by a senior glaucoma consultant. The parameters analyzed in the study are the flashlight test, Van Herrick test, and the gonioscopy. The flashlight test beam was in this the beam was directed parallel to iris from the temporal side, and the crescentic shadow in the iris was graded according to the area between the pupillary margin, pupillary edge, and it's graded as more than half in the grade 1 and half to 1/3 minimal and no shadow in the 4. In Van Herrick's grading, it's graded as 4 according to the peripheral anterior chamber depth. In grade 4, the peripheral AC depth equal to or greater than corneal thickness, and in grade 3, half of the corneal thickness. Grade 2, quarter the thickness of the cornea, and grade 1, less than a quarter. These are my exclusion criteria. The pseudophakic patients, aphakic patients, and patient who underwent laser iridotomy, and patient who underwent intraocular surgeries, and patient with phacomorphic glaucoma. These are my results. Out of 139 eyes, 87 were detected to have shallow AC depth by Van Herrick's test, and which accounts for 62.6%, and 52 were as deep, and which accounts for 37.4%. And among 139 eyes, 94 were detected to as shallow by flashlight test, and which accounts for 67.6%, and 45 were deep, which accounts for 32.4%. Among 139 eyes, 76 were detected to have occludable angle by gonioscopy, and 63 were open. Among 76 occludable angles, 62 were detected to have shallow AC by Van Herrick test, and among 63 open angles, 38 were detected to have deep by Van Herrick test. The sensitivity was 81.6 and specificity was 60.3. And among 76 occludable angles, 61 were detected to have shallow by flashlight test, and 63 open angles, 30 were detected to have deep by flashlight test. The sensitivity was 80.3 and specificity was 47.6. Coming to the discussion, the sensitivity of the Van Herrick test to assess as shallow was 81.6% and specificity was 60.3%. The sensitivity of the flashlight test to assess the shallow was 80.3% and specificity was 47.6%. All the tests showed poor inter-observer agreement. This study underlies the facts that the flashlight test and Van Herrick test are having limited role for screening occludable angles. So the high sensitivity can be used to rule out the disease, but the low specificity cannot be used to rule in a disease. Hence, there is a need for gonioscopic assessment in all these patients. Conclusion, the flashlight test and Van Herrick test having limited role for screening occludable angles. These are my references. Thank you.
Good. Both together, if you compare with gonioscopy, what is the flash plus Van Herrick and versus gonio, what is the sensitivity and specificity?
Van Herrick test.
No, both you do flashlight this many percent, then one. Both together, how many number of patients were detected to have shallow AC? That together you have compared with the gonioscopy?
Yes.
So that is because these are small screening tests, easy to do. So that is in many cases we just look at the slit lamp also. The both together, if you see, that may be anyway something that the specificity is very less. That is the take-home message. Good.
So when you go for peripheral screening, you'll send everybody for gonio, or will you do a flashlight and see who's to be sent for gonio.
We can be used to rule out the disease, but we can't rule.
Yeah, for screening and all, then you don't have an option. Now smartphones are there, but still, you this is important. Okay.
Thanks.